And good evening, everyone. Very happy to see you all again. I always think about what sip I should share with you. And very often I feel that the advice that we give as far as health is concerned, and that's a good thing, it's not rocket science. It's very simple. But what makes a difference is when you put that simple idea into practice. And whether it's the heart disease or brain disease that we want to prevent, um, the advice is more or less on the same lines. Every second, I always talk about the health days that we tend to observe. Every second Thursday, the nephrologists are a little complicated people. Every second Thursday, they don't have a particular date for that, of the month of March is observed as World Kidney Day. And so I thought I'd share the sip on kidney diseases and how you can prevent kidney diseases. Before that, you need to realize that you need to recognize the signs of kidney diseases, and sometimes we miss out on this and come a little late, and then that creates a problem. So we need to understand the early signs of kidney disease. The early sign of kidney disease is the swelling of your feet. If both your feet and your legs tend to swell, then there could be a sign of many conditions, but one of the conditions that it could be is kidney disease. As the disease progresses, the swelling could be all over your body. So even the face could be swollen. So this is the disease is actually, worsened, and the body is, and the kidneys have kind of failed, and as a result of which you have ended up in that kind of a state. So swelling of the feet is an early sign of kidney disease. You need to get to a doctor and get that checked. If the urine is turbid, sometimes the person can be a little drowsy, unconscious. These also could be signs of kidney disease. It could mean the creatinine levels have gone very high, as a result of which these things could happen. Person may be breathless, may vomit, may have diarrhea, may have convulsions. All these are signs of severe kidney disease. How do we prevent kidney disease? Can we prevent kidney disease? Yes, we can prevent disease. And the first thing I need to tell you in the sip is to take a sip of water. So drink water regularly. I keep saying this, you need to sip on water regularly. Keep yourself hydrated. Very often, because water is not available, maybe, or whatever the reason, people don't drink water for a long period of time, as a result of which it results in kidney diseases if you don't drink enough water. So you need to drink water, especially if the person has other health conditions, a mental health condition. They tend to neglect water. They tend to neglect their own needs, as a result of which they may end up with conditions like kidney disorders. So keep that in mind. Water intake has to be done regularly. The amount that is assigned to you, you need to drink. Avoid smoking. That is also another big risk factor for kidney disease. Keep your sugar levels under control. Keep your sugar levels low. Make sure you don't eat too much of high sugary items. Soft drinks, etc., could be harmful, because if the sugars are high, you end up having diabetes. And if you end up having diabetes, one of the important risk factors of diabetes, or one of the important outcomes of diabetes, is diabetic nephropathy, the damage to the kidneys because of long-standing uncontrolled diabetes. If you control your diabetes, no problem. But if you don't control your diabetes, if sugar levels keep fluctuating, it can damage the kidneys. And remember, this is irreversible. Once the damage occurs, it's difficult to do interventions and try to prevent anything there. So you need to prevent the damage from taking place. You need to prevent diabetic nephropathy. Eat healthy. Do not take pills over the counter. Again, especially at this age, you tend to have a lot of aches and pains, and you tend to feel like, okay, let's take a painkiller and solve the problem. Painkillers can cause kidney damage. So your drugs like ibuprofen, for example, if it's taken over a long period of time, I know people have taken only for 15 days and ended up with severe acute kidney damage because of that. So to the extent that the person had to go for dialysis, etc. So you have to avoid taking unnecessary pills. Even some of the antibiotics, some of the cancer drugs can cause kidney damage, can damage your kidneys, and you end up with, you have two kidneys, all right, but then both of them can get damaged, and you'll end up with problems. So you have to be very, very careful with that. Control your blood pressure. Keep your blood pressure under control. Too, a rise in the blood pressure also could be a sign of a kidney disease. So sudden rise of blood pressure. Keep your blood pressure always under control, less than 140/90. Aim for keeping it at 120/80, 120/80, but definitely less than 140/90 is where you should aim for your blood pressure. Exercise regularly, limit the salt intake. All these can help you prevent your kidney diseases and keep you safe. So that's my sip for the day. Be safe, be healthy, and keep your kidneys safe.